My name is Ron Smith. I am the father of Tristin Kate Smith. I would love to share more about my daughter, Tristin. Tristin's passion, I believe, started in junior high school. I think that she was always geared towards helping people. She wanted to be an ER nurse, and that's where she set her goals at. Once COVID hit, I think that she became a little bit more discouraged because one, the number of patients that they were seeing, and they were downsizing at the hospital. Tristin was very much a patient advocate. She was never afraid to question the doctor's orders. She would do everything that she could for the patient. After COVID, I think that she decided to do something else. She did the traveling nurse. She came home once on her birthday, and then I started to hear the stories a little bit more. The reason why she left the hospital that she was working at. There were no breaks. She felt that the security at the hospital was very weak. And I think that with what nurses are being asked to do, I think that she became disgruntled, and she became more depressed, and to the point to where she's told me that she was crying before she goes into work. I talked to her about even talking to a psychologist there, and she said, "Dad, that would be my death warrant as a nurse." She would probably end up losing her license if she went to the people that they had staff there. And I thought, that is just so awful. She didn't know who to talk to. Her note, a letter to my abuser, was about the American healthcare system and how discouraging it became for her. When I found the letter, or when we discovered the letter on her laptop, I read the letter out loud to the family. It was to save lives, to bring awareness to the general public. Hey, this is going on with our nurses in our hospitals. The changes that I would like to see with health workers with their mental health is to have free access to mental health counseling without the fear of retribution, without even the hospitals knowing that they're getting help. Dr. Lorna Breen Foundation, we are on the same page getting help for our nurses. What it means to me is that I'm not alone in this battle, and it is nice to partner up and to have friends out there that can help spread the news, the message, because we don't want to see any more people take their lives. Nurses are burnt out. They are leaving the bedside in groves, and there's a reason for that. This is part of what Tristin talked about in her letter. She was only a nurse for 5 years. And then after that 5 years, I'm talking to her about a career change because of the level of anxiety, PTSD. We have to tell the public about what's going on in our hospitals, what is actually happening. And that is my goal, is to let the public know. I will contact every news organization, and we've written lots of letters, and we're going to make a difference. I'm going to make a difference. I'm not going to stop. And I'll keep fighting this battle, and if there's air in my lungs, I'll fight it.